Welcome to Credentialing Chronicles, where we spill the doctor's tea, honey, hotter than your morning coffee.
And we're spilling it across America, state by state and license by license.
Ooh, I'm Shannon, and honey, she is Nylene, and we are just a couple of sassy credentialing pros with front row seats to all this crazy chaos.
Yes, from coast to coast, fraud scandals to hospital drama they hoped you'd never find.
Yeah, but we find it, girl. So grab your coffee, your compliance checklist, and what, Nylene?
And let's get into it.
Yeah, oh yeah. Well, Nylene and Shannon sitting there talking about you while you pull up a chair. They holding everybody.
And we're back. Welcome back. How are you doing, gorgeous?
Oh my goodness, Shannon, I'm so excited because we have officially made our rounds to my current state, none other than the lovely peach state of Georgia.
Oh my God, Georgia's on Nylene's mind, you all.
It really is. And you know what, Shannon? In this episode, we don't whisper about failures, girl. We spell them out because Georgia peaches prestige and paperwork with lots of plot twists, girl.
Woo, I like how you said that, Nylene. And you know, this episode is what? Basically, bless your heart, but verify that license. Don't play around. Right. That's what we say.
I like that. I like that, Shannon. Oh my goodness, because what we're covering today isn't small. It's, some 9-figured fraud as usual, verification chaos, imposters and scrubs, and malpractice verdicts that will make your risk committee sweat.
Okay. So I'm ready. That's not fraud, right? I mean, what are we talking about?
We're talking about all kinds of things. And of course, let's start out with some fraud because we can't talk about a state, obviously, without talking about some fraud. And this is actually, according to the U.S. Department of Justice, U.S. Attorney's Office
again.
Yeah, girl, they're on every episode.
They are on every episode. We need to get a representative from there.
We do. So apparently 19 defendants were charged in what was described as the largest healthcare fraud in this district's history. The losses in Georgia alone were more than $400 million. Fortunately, it did affect and go broader. So by the time the same scheme got nationwide, we're still talking over $1.7 billion in fraudulent Medicare billing.
We don't even talk about the millions anymore. We just always talk about billions. We're billionaire credentialing people out here.
Mm-hmm. Yeah,
I mean, this is a whole ecosystem every time that you talk about it. Because remember, in order to set up a fraud scam, everybody has to be a little in on it. Remember, we've talked about that.
Yes. And so according to the DOJ announcements, the alleged scheme involved trafficking physician orders. Again, we hear this again, Shannon, for genetic testing. What is going on? Again, more DME, so orthotic braces, pain creams.
Oh my goodness.
Yes. And then this is all through this idea of telemedicine.
Which telemedicine helps a lot.
Exactly.
But I think it does leave a lot of room for some fraud to happen. Yes.
Right. So beneficiaries were allegedly signing up for unnecessary genetic tests. Then the orders were generated, claims were submitted, and then millions of dollars flowing in and out of these claims.
Flowing in. And that's what they like, right? So let's translate that, I guess, for the people out there that are like, how do millions of dollars flow in, right?
Mm-hmm.
I mean, if the ordering provider is the gatekeeper, their NPI, their license, their DEA number, the privilege to authorize those orders, scope authorizes billing power. right? And then telemedicine privileges, without kind of, I don't know, any guardrails or any bumpers or any safety protocols in there. That is a recipe for disaster and for fraud every time.
Yeah, and this is where credentialing lives, because really privileges authorize this ordering system, right? And then a scope of practice authorizes the billing power. And then unfortunately, telemedicine privileges without guardrails, well, then obviously that adds velocity, because telemedicine, you could go bam, 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 talk to somebody, hey, my wrist hurts, let's order this. My knee hurts, let's order this, without really truly finishing everything up, right? Or fully being able to do a hands-on examination on somebody. So pretty crazy. Fortunately, it did hit Georgia.
Crazy.
And it is a violation, and you would be reported. And so what kind of verifications do we have to run to see if a doctor is excluded from any billing? So what are those verifications, Shannon, that we all have to do in credentialing? And actually, when you hire any healthcare provider,
Yeah, really. That's the OIG, the state Medicare exclusion. That's going to be your SAM, which stands for System of Award Management. That's also going to be, NPDB, is a good one to make sure that you're running and part of that program. And OFAC. A lot of people don't know about OFAC, but the Office of Foreign Assets Control. You can run over there. You can run that as well. It's a free verification, and it lets you know if your provider is actually out there moving assets over to Switzerland and Amsterdam.
I like that one. We should put that in the show notes for this episode.
Yeah, make you feel fancy,
Yes. And then obviously those things are standards of practice. We need to make sure we're verifying those. And then of course we have to verify our doctor's licenses. And that's where I love systems like Baton, because if we want to talk about stopping chaos, because if you're managing especially multi-state verifications across fragmented portals, if you have doctors across state lines, you have one huge medical group like we just described covering Georgia, Mississippi, Alabama, Florida. Well, that's where systems like Baton really come in and help us as the credentialing people to do this.
Yeah. It's not just a database. It's really like a control tower where you're able to get a little bit of a bird's eye view into the different states at one time. And it really does assist with really trying to manage and kind of run all of those for you.
Right, because you're going to be able to get those automated license monitorings, real-time status tracking, expirable alerts.
Discipline.
Love it. Love my Baton.
Okay, so what I was gonna say, we gotta talk about something else.
Let's talk about my issue with Georgia. So, coming to Georgia, I'm all excited. I'm like, yes, we're going to do some credentialing in Georgia. Now, little do you know that every state is different. Shannon, can we talk about, girl, the problem is when we talk about verifying these licenses and having a portal, it's great, right? Except Georgia decided to separate them. They aren't unified across disciplines, girl.
No, they're not. They're definitely not.
Unfortunately, I have to go to a different website to check nursing and podiatry. Under this Secretary of State's goals system, physicians and PAs, sure, go to the Georgia Composite Medical Board. Dentistry? Oh no, why would we make that easy for you?
Even if it is a doctor of dentistry, but no, they have their own board. Right. And so one provider group, 3 browser tabs, and a system crash if you blink and you don't get any of your verifications,
And nurses hasn't even caught up. So according to the Georgia Secretary of State messaging, the goals platform was rolled out supposedly to modernize licensing, reduce backlogs, and digitize processes, which is great, right? We're all for modernization. But unfortunately, fragmentation without integration is an operational risk, Shannon. And what do you think? How does that hands-on affect a credentialing person to have to go to all of these portals.
Yes, because, when one portal is down, and another isn't synced up nationally, your verification clock keeps ticking, and you're not able to get things done efficiently. It makes it hard. You have to learn, you have to update your own spreadsheet of where you have to go because, unless you have a credentialing software like Baton.
Right. But even credentialing softwares are having and platforms, right? So different software vendors out there are having problems linking to these new sites to get the license crawlers up to date. So it's like, why would you do that? When databases can't auto pull consistent feeds, you're back to then manual monitoring. Great. Now I have an expiry, but it's not, I'm supposed to get my crawler every month to pull my license verifications. So if it's manual, it's going to delay.
Sometimes it is things do need to be done manual. We're a CVO. So as you know, we are running licenses, we're running over 3,000 licenses a month. And sometimes, I'll be honest with you, at least 60% of the time there's a crawler issue with someone in some state. And so what does it depend on? It depends on your verification person, making sure that they're able to still do that process manually. Because again, like you say, it just becomes harder and harder to go in there and get the license or it doesn't pull correctly where it looks NCQA compliant or, things like that.
So exactly. So I don't think AI is going to solve this problem anytime soon or try to assist on these web crawlers, girl. So MSPs, y'all got some work going.
Yeah, I think it's laughable when people say, "Oh, AI is going to replace credentialing." No, boo, not there. We are going to be the ones that don't get replaced.
That's right. So, quick commercial break. We do have to talk about one of our sponsors, HST Pathways. And because we've been talking about verification, privileging, fraud, and all of this stuff, but let's zoom to the ASC world for a second. If you're running a ambulatory surgery center, your risk doesn't stop at credentialing. It really follows the patient into documentation, workflows, and surgical reporting. And that's where a great system like HST Pathways comes in.
Yeah, and just to be clear, HST Pathways is an ASC-specific EHR, not a credentialing database, even though they do have some credentialing elements.
Yes, they do. And what's great is you can actually put the doctor's license on there and the expiration date, and it'll stop you from scheduling the case if the licensed doctor is expired. So it really is an environment where timing, accuracy, and documentation, are everything. Because when a malpractice case questions what happened in the OR, or when auditors review documentation for reimbursement, really your EHR is going to become your evidence.
If it's incomplete, inconsistent, or it's hard to track, baby, guess what that's called? Exposure.
Love it. So HST Pathways helps ASCs maintain structured documentation, streamline clinical workflows, and support compliance. So your records protect you instead of haunting you. All right, Shannon, let's get into our next story.
Okay, is Georgia bringing it? I'm ready for some Georgia drama.
Girl, when medical authority becomes unchecked power. Okay. He wasn't operating in secrecy in a basement. Okay. He was a respected community doctor. He was a father. He was actually a Sunday school teacher's husband. And he delivered babies and he treated families. And
he did it all.
But that's what actually made this possible.
I'm kind of scared. Authority, plus trust equals, access every time, right? Whether it's healthcare or in the churches or, in the Boy Scouts of America, it's everywhere. It's prevalent all over the United States now. So, oh my goodness, I'm scared to hear what you're going to tell me.
According to reporting, beginning in the early 50s, and I'm going to bring this back because these babies are actually coming on TV now. But anyway, beginning in the early 50s, this doctor allegedly began advertising abortion services to young, unmarried, pregnant women. Often they were poor women from Georgia and some from Tennessee through discreet postings in places like bus stations and phone booths.
What? Which tells you immediately, I mean, who he's targeting, right? People that are, vulnerable, people that are isolated. I mean, basically, the people that are desperate, right?
Mm-hmm. So, according to investigative accounts, this is how the operation allegedly worked. Okay. So, you had a young pregnant woman, usually like a teenager, unmarried, and they would seek an abortion because it's the 1950s, right? Like you have to be married. So instead of performing the abortion in some cases, the physician allegedly would persuade these women to go ahead and carry the baby to term, figure out how you're going to hide it, whatever. Then he would arrange housing for them nearby, sometimes in like a local hotel, until they delivered the baby. After the birth, the babies were transferred to adoptive couples, often from outside of the state, without a formal adoption process. So he'd like contact people like Underground Network. I got a baby coming. Come and get a baby.
That's crazy. I'm like, oh my God. So there's no courts, right, for the adoptions, right? That's what you're saying. There's no like adoption agencies that's happening because this is again the 1950s. I guess they're not having the people sign any consents I'm pretty much no safeguards for the babies, for the mothers, for anybody, right?
Exactly. And here's where it really becomes criminal level disturbing is that according to multiple victim accounts, some birth mothers were allegedly told that their babies had died shortly after delivery. Yes. So instead, the infants were just placed with paying adoptive parents.
That's not adoption, boo. That's trafficking.
That's human trafficking. Yes, ma'am.
Yes, ma'am.
So the mechanism that made this sustainable was documentation manipulation. So according to reporting, birth certificates were allegedly falsified. And in some cases, the adoptive parents were listed as biological parents directly on the original birth certificates. So that means there's no legal adoption decree, no formal record of the actual birth mother, no traceable biological history, and nothing they could do about it.
Ooh, which means when those babies grow up, they have no paper identity that match their biology, who they are.
Exactly. So decades later, adults who discovered inconsistencies in their birth records began investigating. So in 1997, public exposure began when several adoptees uncovered shared origin patterns, with the adoption of Ancestry.com and all these like DNA sites, they started noticing the same clinic name, the same doctor name.
Oh my goodness, girl. So basically, they're just paying for babies. I mean, this is just fraud.
Absolutely. And so what they ended up doing was they started following the money because according to some reported accounts, adoptive couples paid anywhere from like a few $100s to several $1,000s. Now you think about that, that's a lot of money in the 1950s.
That's a lot of money.
Yes, there's tens of thousands of dollars in today's money. Uh-huh.
Dang.
And so they made these payments reportedly, supposedly, depending on how much money that family could afford.
So he said, give me what you can. Give me what you could.
Or if they looked really rich or depending on the car that they were driving or whatever, that's how he would charge them.
Oh my God. He had dynamic pricing before Walmart, I guess, huh?
That is so wrong.
That's wrong. I'm sorry. But man, what a story. So tell me, girl, how did he get caught? Like what? Did he go to jail when he was 80 years old?
Well, what happened was...
Is his license still active? Oh my God.
No, he's deceased now.
Okay.
He ended up surrendering his medical license in 1964 after being arrested for actually performing some illegal abortions. And then he ended up dying in 1972. This adoption scheme itself, though, was never really criminally prosecuted in a way that addressed the actual full scope of it. largely because nobody found out about it until 20, 30 years after he had already died anyway.
I bet all the people coming together, they have a support group and stuff now. I guess by the time it all came out, the main actor was dead, gone, and buried away.
And then this left the victims, unfortunately now adults, with DNA tests, fake fragmented family trees, and then unanswered questions about where they actually came from.
Dang. And it's just crazy with the DNA. It's like all of these, every time is like a genetic testing fraud, and this was even before the genetic testing came out.
Right. So then fast forward to now you get into like the 2000s, 2010s, people start doing all the DNA tests. Like I said, they found siblings, they found parents, they discovered that they had been lied to about their births entirely. Could you imagine finding out that the child that you gave birth to was actually alive?
That's
after
crazy.
You had been told by a physician that they had died? The trauma.
That is insane. I mean, that is truly insane. And I mean, really, when, it's just, you can't depend upon, the system. You can't depend upon like who gave birth to you. That could be identity shattering.
For sure.
Yeah, totally.
So I understand that this happened many, many years ago. And
yes.
But this is why it matters in 2026 is this truly wasn't enabled by technology. It was enabled by unchecked authority, weak oversight, community silence, documentation control, and the absence of any external review.
Yeah, I mean, truly, right? A license, if you're not monitoring the license, then you're not putting guardrails, you're not ensuring accountability, you're not making sure that the provider is still fit in order to see your patients, which is negligent. It's very, very negligent.
Mm-hmm. So in a small town, right, reputation shielded scrutiny. So let's see what are some lessons we can learn about it. Well, just because you have an active license, credentialing is like, oh, let's just check the license, right? We still have to have oversight. And I'm glad that we've put all these systems in place, but you've got to have peer accountability, ethical governance, transparency, because harm doesn't always look like fraud. And sometimes the actual community, or just because this doctor has a really good reputation in the community, the people in power can weaponize this power, if I can say that.
And I think the, most haunting part of this story isn't just that it happened. It's that for decades it was, normalized, which is always the saddest part of all of our stories.
And that's why we say, credentialing isn't paperwork, it's protection, girl. Right?
Every time.
Okay, so I got some more nursing imposters. Girl, every state, these hit every state.
They left Florida and went all over.
Girl, Fox 5 Atlanta, a cosmetic surgery related scandal included allegations of unlicensed practice and fraudulent claims. Separately, Georgia Secretary of State maintains a public page, girl, for nursing imposter alerts. How amazing is that?
Oh, Georgia, that is like incredible. The fact that there's a whole webpage for that tells you that, it's not theoretical, that it's something really happening out here and people are taking it serious.
Yes. So here's the educational punchline of what we want. If your credentialing process does not include this website, which we will link it, then you're not doing a full credentialing check on your nurses. You've got to do your state verification. You've got to do your sanction checks, just like Shannon said earlier. You've got to do your litigation review. You've got to do a malpractice claims history. Have your public alert monitoring, right? Basic online footprint review. Shannon, what is it that you always say about Google?
You got to put your Google alert, you got to do that because if something pops off, you're going to be the first one to alert it about it. Google's going to let you know. Mm-hmm. Google's going to let you know.
Ooh,
I thought you were going to talk because you're in Georgia.
Mm-hmm.
And, you are the CEO of Lecaconi. and then you help all of the other people in Georgia that you help. You're like the credentialing superhero of Georgia. That's how I look at you.
Listen, I couldn't do it without my resources.
Well, I thought when you put this episode together that we were going to gossip all about the plans. I thought you were going to vent all your frustrations with the denials and the pre-auths. Like, I really don't even want to hear the fraud. I want to hear Nylene vent.
No, well, listen, my biggest venting is when I came to the state and I couldn't find the stupid license. I didn't know how to verify. I didn't know how to verify a license. Like me, I didn't know how to verify a license. And I was like, what do you mean I can't find a podiatrist? And I had found this when we did the episode on Heels and Deals, back in season 1. And I was like, why can't I find this podiatrist? Like, why is this giving me such a hard problem? And we had mentioned it was hard, but I didn't realize, girl, there's a whole other website and it's not easy to find. And it's just like, if you're not in that world. And so can we also talk about peer review and the peer review statutes in Georgia? Girl, they are really protected here in Georgia. So it's really interesting. So I learned about this whole thing called executive session. So I will make fun of myself a little bit. So here I come. I'm like, we're protected by peer review. I have my disclaimer. I have all my stuff on my agenda, on my minutes. I'm showing them how to do it. And they're like, well, we have to go into executive session. And I'm like, what? What is this thing called? I'm like, isn't the whole thing protected? So I got schooled a little, and that's fine. I'll own my mistake, which is fine. But I do think it's really cool. So the MEC jumps into this thing called executive session. So for my Georgia people, don't laugh at me, guys. I didn't know all of this. Okay, state of Florida doesn't have it. Okay,
that's why every state is different, y'all.
Yep. So they jump into this executive session, and then we can talk about credentials. And then we come out and we talk about credentials again, but just like the names of the doctors, it's very weird, like that it's approved. Because I'm like, you have to approve it in public because you have to say that they were approved. But like, you still go into executive session because the executive session is where you can actually talk about anything. But we didn't have anything to talk about, but we still went to an executive session. So I'm still learning all the little nuances about this secret executive session that's extra non-discoverable. But I think it's really good because I think it really provides a good, safe environment for physicians to have honest conversations and credentials.
Yeah, which is what matters.
To protect the doctors. So doctors, you do have an extra layer of security in Georgia, which I absolutely love. Your peer review statutes are beautiful. And then let's talk about CRNAs. So CRNAs are the nurse anesthetists. And in the state of Georgia, according to the Georgia Board of Nursing, they have to work. They can work under the supervision of a physician.
Okay.
But podiatrists aren't considered physicians. So technically, a podiatrist can't do his H&P and can't supervise a CRNA. So I'm still working out those details. So y'all from Georgia, help me out, please, because our hospital will not allow the CRNAs to work with a podiatrist. And I did look up the Georgia Board of Nursing. I reached out to the nurse CRNA group of Georgia just so that they can help me kind of make sure that this is correct. So what they do is they have the anesthesiologist do an H&P on the patient, and then they have to oversee, or if there's another physician, and that physician would serve as the supervising physician for CRNAs, which is very different than many states. Many states have already allowed CRNAs to work 100% independent. And in Florida, podiatrists can do H&Ps. So lots of learning, lots of craziness. And then, of course, we have the famous Netflix special that came out on the doctor who had a PhD, but not an MD, and was calling himself doctor. So is a PhD a doctor? And the answer is yes. Just he was fraudulently using it to make you think he was a medical doctor when he actually wasn't.
That was a good episode. Well, I need to know any payer stuff you want to tell us about Georgia. Because I know you be on the payer wagon. You be having some drama with them.
Listen, I hate that it's a certificate of need state. So payers are denying our surgeries because they're saying that they can be done at surgery centers. And the problem is my doctor does not have privileges at a surgery center because he can't have ownership in a surgery center because he isn't part of a big group. We are independent. So while we can try and get privileges at a surgery center, it's the same thing for him. Like, we're still giving the money to somebody else. He doesn't have a personal interest. And where we are in our little town, we are very, very, very far from a surgery center. So our closest facility is a hospital, which is only, 5-7 minutes down the road. And our next closest hospital is 30 minutes. Neither one is close to a surgery center that he would even be able to go to. So we have to fight with the insurance companies because they don't want us to do carpal tunnels or knee scopes at hospitals, which, we wish that we had a surgery center, but right now, financially, number one, can't afford to build one right now.
Things like that, yeah. Things like that don't help.
Like that. Also, because we are in a small area, weaponized credentialing, like we talked about in season 1, girl, it's a thing. It is a thing. It is like one group against another. Yes.
No.
Mm-hmm. One group against another. You got a big orthopedic group. You got a new doctor coming into town. Like, ooh, who is he and why is he in that area? I'm like, well, we need to play nice.
So competitive.
Yes. Very, very, very competitive. Even though it's such a massive area for very few people. To get on panels wasn't an issue. Payment is actually very low, but nobody denied us. Not denied us, I'm sorry, but nobody said that the panels were closed. Right. Nobody said that the networks were closed because there's minimal number of physicians per the ratio of people.
Good.
So that part wasn't difficult. And can we talk about Palmetto GBA, which is the Medicare, our MAC for Georgia? Which, by the way, is fantastic. So having come from Florida, where we had to deal with a completely different MAC, whose delay times were astronomical, Palmetto GBA, I think, was fantastic. They are super, 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 super amazing to work with. PICOS, my Medicare application, was processed quickly. It was fantastic. So that's my tea on Georgia.
I was like, Nyleena's out here spilling the tea, y'all, on Georgia. Thank you, Nyleen. I say I love your stories, but I just wanted to hear some of your tea because, you're there.
I know. So we do have to do our little PSA section before we close out, though.
Definitely. Okay, so are you going first or I'm going first? Who are you doing first? Tell me.
Well, let me talk a little bit about the doctors. So doctors, you can get on some panels in Georgia. Good thing. Look for some rural critical access. We need some cardiologists out here, some rheumatologists, some nephrologists. We need some of that. I need some of that out here in the middle of nowhere, Georgia. But guard your signature, and your signature has the value. Don't sign what you didn't evaluate. Understand telehealth documentation standards. There's very specific modifiers, very specific documentation you need to have. Watch those billing patterns and say no if somebody pressures you to something. And don't compete with each other. Be nice to each other if another doctor with the same specialty comes in your area.
Be nice. I know, right?
All right, talk to our MSPs, Shannon. Talk to our MSPs.
Yeah, you have to remember you all are not secretaries. And if a doctor is calling y'all a secretary, tell them to call me up. Tell them to call Nylena. We gonna let them know.
Tell them, Shannon.
Okay.
Tell them.
You are a gatekeeper. You are a superhero, honey. You wear a cape. Use centralized databases like Baton. As we always say, you want to integrate your privilege system like HST privilege pathways allows you to. And, try to build redundancy into your verification workflow. Check your crawlers. Like we said, if the crawlers ain't working, then just do a manual. I'm sorry, but I come from a time where everything was manual. We were sending letters out to the peers, baby. We were sending letters out to the hospitals, with a stamped envelope in there for them to send it back to us. So, I come from that old school credentialing. Track expirings aggressively, escalate red flags when you see them. Escalate a yellow flag if your gut is telling it to you. Ain't nothing ever wrong with checking twice. Do you have anything for our patients that are listening? Our patient population, baby, is growing. I say, y'all listening out there, honey. I'm so excited to have y'all here. Like, follow, share so that we can get more patients listening on board. Okay, Nalene has a PSA for y'all.
Okay, so for the PSA for our patients, verify your provider's licenses. We're going to give you the links in the show notes. Question your surprise testing. Check your EOBs, which is the statements you get every month from your insurance company. And asking questions is not rude, but please pay your bills. Pay your bills. Pay your doctors because they work really hard.
I'm trying to build this population up.
I'm sorry, but they got to pay their bills. Listen, if you have surgery, the surgeon went to school many, many years. Can you please pay your bills? That's all I'm going to say. Yes, but we love you. We love you. We want you to ask all the questions. We want you to get all the assistance.
Spilling the tea.
And just so y'all know, it is a 90-day global period. It is a 90-day global period for the same issue. Okay? So we're going to treat you for free for 3 months. We're going to treat you for free for 3 months after your surgery. But could you please pay your surgery bill? Okay. We love you. We'll tell you how to check your doctor, which are amazing.
Stay credentialed, not cancel, baby. That was a whole nation's worth of tea, girl.
Ooh, and we are just getting started. More states, more scandals, and definitely more receipts.
And if you love the tea we're spilling, you gotta like, you gotta comment, follow us, share, do everything. Where can they do all that at, Nylene?
They can follow us on LinkedIn, Instagram, TikTok, Facebook, on all the things. And share it because the tea is going coast to coast.
Ooh, I love it. See you next time on Credentialing Chronicles. Remember, you got to stay credentialed, but not what?
Not canceled.